I now would like to ask Ms. Herrera Beutler for her opening comments.
And I'll keep it brief. I wanted to share a story. I had a young woman in my district in Clark County come and visit with me a month or two ago. And she was there to talk about electronic medical records or personal health records or e-records for hospitals or small practices or solo practices. And her story was compelling. Her father, who was a constituent of mine, would bike every day up and down perfect physical health. He was between 55 and 60, I believe. Tremendous. And he had I don't know if it was a palpitation, he had a problem. They took him to the ER, and she was a nurse. She went with her mom, and she said, we think there's something here. She said, I think there's a specific issue here. And they ran the tests, and they waited, and the test came back negative. They said, you are fine. So they sent him home, and I think within it was 2 weeks. It was a shorter period of time. He had it happen again, and he died. And, she was devastated. The family was devastated. And she said about a short period of time after that, she received a call from the hospital that said, we're so sorry. We lost the paper record. And it actually wasn't negative, and went on to explain it was a problem with the paper. It was a problem with losing the paper. And it's so hard to sit there and have someone, you hear about it, you hear this is partially why we need to upgrade, we need to get there. And here's someone who works in the medical profession, and she was looking at me saying, do everything you can to speed the implementation of electronic medical records for many reasons. I mean, we talked about Katrina. I have in Lewis County in my district, can have severe flooding, which wipes out homes. Floods 8 feet plus of the bottom and up to second story homes. And when that happens, these are older communities. Their medical records could be, I don't know, their immunizations could be stuffed somewhere in a file. And what happens? We lose patient records, and it is imperative. I served here on the Hill as a health policy aide before elective office, before going home and then coming back here. And this was a bubbling issue, in the last decade. This has been something Washington State has worked towards, a state partnership along with the federal efforts in a very bipartisan way, because we recognize we have to get there. The challenges are costs and implementation. I have a doctor from Southwest Washington who's going to share a little bit about her experience. But the reality is, we're trying to find out what we don't know, to Mr. Richmond's point, and figure out how we can speed this along, because paper is, as someone who represents a timber industry, I like using paper in a lot of areas. Let me put that on the board. But when it comes to this issue, we need to make sure that we are entering the 21st century. So with that, I yield back. Look forward to our testimony.